Hello friends, I am Dr.Shripal Shah, interventional neurologist and stroke specialist. I am heading neurology department at Sahyadri Hospital, Nasik. Today I would like you to know about brain stroke, which is also known as brain attack or paralysis. Brain stroke is of two types, ischemic stroke and hemorrhagic stroke. Ischemic stroke is because of the clot which is formed in the vessel which supplies to the brain. Second is hemorrhagic stroke, which is because of the bursting of the vessel and which causes bleeding in the brain, also known as hemorrhagic stroke. So the risk factors for stroke are hypertension, diabetes, high cholesterol, smoking, alcohol, bad lifestyle, stress, increasing homocysteine because of low B12, some cardiac problems which have rhythm abnormalities which can also cause stroke. So what are the symptoms of brain stroke and how do we identify these symptoms? So there is a tagline called as be fast. B is for balance. If there is sudden loss of balance, and chakkar or imbalance. Second is E. E is for eye, that is sudden onset vision loss or diminution of vision of one eye or both the eyes. Fast is for F is for face. There is deviation of angle of mouth or face. A is for one side weakness of arm or legs. S is for speech. K, there is slurring of speech, unable to speak or unable to understand. And T is for time taken to understand these symptoms, which are very important in brain stroke. So this what we understand is about the types of brain stroke, what are the risk factors, and how do we identify brain stroke. So how do we prevent brain stroke? One is to control our blood pressures, sugars and cholesterol. Avoid all the bad habits like alcohol, smoking, tobacco chewing, less amount of stress, good sleep of 7 to 8 hours, and a healthy lifestyle with 40 to 45 minutes of daily vigorous exercises and a good diet which is high in proteins and low in carbohydrates and high content of vitamin B12. This will help us to prevent brain stroke. So how do we treat brain stroke? So over a period of last 1 decade, there is change in treatment of brain stroke, and the newer treatments which are available are IV thrombolysis, which is clot dissolving agent, and mechanical thrombectomy, which is removal of the clot doing angiography and using stent retrievers. Now these treatments are available only where there is a stroke ready center and which are done in the golden hours of 4.5 hours. If we treat such patient in the golden hours, they will be benefited better and the improvement will be seen significantly, and we can avoid morbidity also and mortality in such patients. So Sahyadri Hospital, Nasik is a stroke ready center, and all the facilities which are required for a stroke ready center is available at Sahyadri Hospital. We have in-house CT, 1.5 Tesla MRI, dedicated neuro cath lab, dedicated neuro ICU and stroke ICU, and interventional neurologist and a neurosurgeon who are dedicated for stroke patients and their treatment. Also, we have a neuro rehab center. After the patient improves from acute stroke condition and shifted to wards, he has been taken care in the neuro rehab center by dedicated neurophysiotherapist also and dietitians. Thank you.